Women are about 3 times more likely than men to have migraine headaches, and we really don't see this difference until puberty comes along. And then the difference between boys and girls becomes much more prominent, and that's when women start to have much more frequent migraine, or much more prevalent migraine than their male counterparts. We know that as many as 50% of female migraineurs have a hormonal component to their migraines, and that is they seem to be more common in certain parts of the menstrual cycle. They seem to be more common after pregnancy, not during the pregnancy when they tend to get better, but after they deliver the baby. And they tend to be more common in the perimenopause time frame when hormones are a little more erratic and are bouncing around a lot more. And what we think is going on is we think it's actually a drop in estrogen levels, a quick drop that seems to precipitate headaches. And that means that women around their premenstrual time frame can have that drop in estrogen and experience what we call a menstrual migraine during that time. We actually don't know why the drop in estrogen seems to trigger migraine, but it has been determined that falling levels of estrogen seem to be a potent trigger for women. And so that's why it's typically 1 to 2 days before the menstrual cycle and lasts a couple of days into the menstrual cycle when the estrogen level typically picks back up, that women are most vulnerable to those headaches that can really be terribly disruptive and cause a woman to, lose 4 or 5 days out of her normal functioning month. So not a small thing. Well, this whole concept of looking at the hormonal part of these headaches is somewhat new. And probably hasn't hit the mainstream so much yet. And so migraines can be managed with a number of traditional therapies that most of the time are effective. But I think it's important for women to know that we can also address these drops in the hormone levels, especially with menstrual migraine, to actually prevent the headaches. And so there are some what we call hormonal manipulation techniques that we can use, meaning we can prevent the drop in the estrogen level that often triggers these headaches for women and makes them so disruptive. It's fascinating that women are actually often underdiagnosed with migraine, and what they call simply a headache is often truly a migraine. And when they went back and sort of looked at how many women received the proper diagnosis, only about 16% of women with headaches actually got the right diagnosis if they weren't seeing a headache specialist. And so it's important for women to know that they may not think of it as a migraine. They may just think of it as a headache. And if these are occurring, however, on a regular basis, say right before your menstrual period, right before the period starts, that's more than just a headache. That's a migraine.